In less than 2 months, the coronavirus has killed more than 2,000 people, spreading to almost 50 countries.
Of course, now the virus is in the global spotlight, and as CBS 13's Marissa Perlman explains, as the number of cases go up, so does the fear in the community.
Yeah, that's right, guys. It is causing a lot of fear with now 82,000 people infected worldwide. Health experts say, though, it's unlikely this will rise to an apocalyptic scene. And tonight we're learning coronavirus and its global sweep is stroking fear over facts.
Anything that is uncertain and uncontrollable, as this virus has a potential to be, it makes people anxious.
Anxious and afraid. Dr. Emmanuel Medenberg, professor of psychiatry at UCLA Medical School, says the fear and urgency is real and valid.
Every time somebody coughs, I get nervous.
Sudden movements under scrutiny. That same fearful behavior seen at airports and hospitals.
I'm at the hospital a lot of time, and people are very cautious, and people want to protect themselves.
Adding to the chaos, tumbling financial markets and conflicting responses to the virus's spread. Left now emotional neighbors, unsure of how much alarm they should feel.
A distinction should be made between public health risk and the risk to each one of us individually. And these are two separate things.
Dr. Medenberg says people fall into two groups here, those that are fearful of an epidemic and those who say our individual risk is low.
I think both groups have something to justify their response to, but a more balanced response would take into account fairly low or very low risk on the personal level.
Well, it really is interesting because some people are afraid, some people are not bothered, but you're learning social media somehow plays a role in this.
I thought this was really interesting. Dr. Medenberg talked about our habits. He said those of us who are constantly tuned into the headlines, following this, every case on social media, are more likely to be susceptible to fear. And he says those stores sold out with all the face masks, that's a prime example of that.
All right.
Consuming more information.
It's important not to overhype it. Stay with us. We're going to give it to you straight. All right. Thank you, Marissa.